I know most of the time in acute we don't have time. Most of the time in acute we do symptomatology totality and give them acute remedies. But I say just go little further. Acute is also nothing but the crystallization of the whole state. So if you really stay with it, now state can be external, state can be internal. So if you stay with it by only staying with present predominant picture and keep all your energy, all your question designed in such a way, what we call guided passive, so that patients stay with that acute, bring out the whole change at physical, general, mental level as well as holistic level which came with that acute. That will help you whether it is same constitutional state or it is external causing its impression, the type 2. And design your question in such a way where you directly, whether with a general case taking, touch the whole. First bring the whole out and then go with the whole. PQRS at holistic level. Or do internal witnessing where you directly touch the whole. And depending upon whether it is local or whole. If it is local, then mother teacher to 12C. If it is whole, then it is 32 mm, depending upon level of experience. And I'm convinced, okay, you don't do with this simple cold, cough, viral fever and all. But when the patient has typhoid, malaria, jaundice, these are the cases I'm showing you, or severe acute emergencies like I show you TIA, or situational, try to go do case taking at holistic level. I know out of 10, 6 or 5 you will just what knowledge you have of acute remedies, it will work, and that's what we do in clinic. We give those acute remedies. But other 4, 5, if you really go to the depth, then the result, you will get that unique remedy in acute as well as, and the depth and the result would be there at a whole. And acute, in fact, we have to, whenever acute comes, we have to also be at the acute level because that's the only window to understand this patient's true state, whether it is external or internal. Because in acute, all defenses are broken. So you have to be highly alert. Whenever acute comes, call patient. It will teach you, not only it will give you, if you have not got a right simillimum, it will give you right simillimum. It will give you right totality. And not only that, if you, because the patient is suffering, his defense are broken, patient right there, patient is vulnerable right there with his whole altered pattern. And if it is type 1, where he is touching his own altered pattern and defenses are broken, imagine if you keep him there, he can be completely aware of it. He can see that window, go out completely who he is. Because in acute, all defenses are broken. So acute is a window to your chronic simillimum. Acute is a window to know your own altered pattern, to know yourself.